So my name is indeed Jan Dekkers, and I've been at Newcastle University teaching ethics within the medical school since 2001. So I'm very passionate about this subject. What is medical ethics and why would it matter? So medical ethics is ethics in relation to medicine. It's quite an easy definition, right? Of course, then the question is, what is ethics and what is medicine? Medicine, I understand to be the study of treatment for illness or injury, according to the Cambridge Dictionary. We probably all have a reasonably good idea. That's probably quite close to this definition of medicine. Ethics is perhaps less commonly understood. Ethics is also the same as moral philosophy, which is a branch of philosophy. Philosophy is thinking about the meaning of life, right? You might say. What is reality? Those sorts of questions, deep questions. Moral philosophy deals with not so much with what reality is, but what reality ought to be like. Ethics comes from the word ethikos, which is a Greek word, which means moral expressing character. It's an interesting one, character. And ethos, from which the word ethos is derived, means character, moral nature. Okay. Probably many people don't think of ethics in terms of character. Maybe there's a good reason for it, because many people often associate ethics with moral theory. And they think of it as quite a highbrow sort of thing. Whereas character is something that I'm sure you'll agree we all possess. Now, from our character, we might develop a particular way of thinking about what we ought to be doing. And that's what ethics is about. Perhaps I'll start by talking a little bit about why it would matter that we have a subject like medical ethics. In the picture here, you see a doctor who is treating somebody with a placebo, injecting them, right? And this doctor is somebody who was involved with this Tuskegee syphilis experiment. The Tuskegee syphilis experiment was run in the United States of America, and many doctors contributed to it. It ran for about 30 years, up to 1972, and 399 black men were never informed that they suffered from syphilis, in spite of the fact that there was already a cure available for syphilis. So they never benefited from treatment, in spite of the fact that the treatment might well have cured them. The reason why they were never told is because the doctors who were involved in the Tuskegee syphilis study were interested to explore how syphilis affects the human body. So they were following these people, incidentally, or perhaps not incidentally, all of them black, for a very long time, and they collected information also after they had died to find out what the effects of the human body are of suffering from syphilis for, in some cases, a very long time, right? Now, it might well be medically important for us to know what the effects are of syphilis, but many people think that this is a clear example of racism, and not just racism, but also an unacceptable way to treat people. If you already have a treatment available, people should be offered a treatment, right? Rather than for them to continue to suffer. And people should also be informed of the fact that they are suffering from syphilis. They were never told that they suffered from this disease. Okay, that's just one example of why it matters for doctors, as well as everybody else, patients as well, of course, to think about ethics in relation to medicine. Now, you probably have heard of the infected blood inquiry in the United Kingdom, yeah? Because we have had a contaminated blood scandal, okay? a lot of blood was imported from the United States of America, and this blood happened to be infected with HIV, hepatitis C, and some other conditions. And it was not screened, this blood, okay? It was just being used, in spite of the fact that people knew that there was a high chance of this blood being infected. Consequently, a number of people who were given blood transfusions, for example, people with hemophiliacs who had blood factor issues, right? And therefore needed transfusions, were infected as a result of being treated with this infected blood. It's not just the case that people could have known that there was a high chance of this blood being infected, but in some cases, people actually did know. And nevertheless, they just carried on using this blood, right? And there's a BBC report that was published recently about this, saying that more than 30,000 people were infected with HIV and hepatitis C in the 1970s and 80s. The chair of the inquiry into the blood scandal is reported to have said this disaster was not an accident. The infections happened because those in authority, doctors, the blood services, and successive governments did not put patient safety first. Okay? Now, while this disaster was not an accident, the question must be asked whether similar accidents happen frequently and how we might be able to avert them. Because of course, now we know about this scandal. For many, many years, we were unaware of this, even if many people were suspicious, right? That some people knew that this blood was infected, or at least that there was a high chance of this blood being infected, okay? So, we can be culpable, we can be doing morally the wrong thing, either deliberately, where we deliberately want to infect people with blood that has been infected, or we can do so recklessly. And recklessness refers to a situation where you do not deliberately design people to become infected, but you can say, actually, look, this was actually a foreseeable consequence because you knew that this blood was obtained from sources where there was a high prevalence of HIV and hepatitis C. Therefore, you should have screened that blood for these diseases rather than simply used it without checking whether it was safe first. Okay? I hope it's not going to put you off medicine, having started a session like that. I hope it will not do so, because we need doctors as well as we need other healthcare professionals. So how do we think ethically about medicine? We need values, we need principles, and we need theories. I say ethics there, that word actually should be principles, right? Values, principles, and theories. So a value might be happiness, or health, or respect, or honesty, or candor. Being candid with patients, say, for example, yeah, being truthful. And principles are sort of action guiding. They combine a verb usually with a noun, and the noun is a value. Yeah, for example, promote happiness, promote health, be honest, okay? Or do not lie, and so forth. All of those are principles. And then we have theories, okay? And a moral theory is the outcome of theorizing, okay? Whereby we decide which values matter. And sometimes we may value multiple values, right? And we may not be able to act in accordance with all values. So in those situations, it's important to sort of prioritize some values over others, or to prioritize some principles over others. For example, You might have a highly anxious patient. Are you going to promote happiness if you tell that patient that they are seriously ill? You want to be honest with them, right? So there might potentially be a clash, and it may be difficult to weigh up. What do you do in that situation? If they're highly anxious, if you're going to be honest with them that they've got a serious condition, are you going to tell them? Or are you going to try to promote their happiness by not informing them? Okay? Now, I'm not suggesting that it might be the right thing to do, not to inform them. Perhaps there might be some situations where that might be appropriate. But in any case, it's necessary sometimes to weigh up these principles because not all of them can be fulfilled. Okay, formal ethical theories, consequentialism and deontology are examples of formal ethical theories. And the reason why I call them formal is because they're about the abstract kind of things that matter. Or you might call them abstract ethical theories. Consequentialism, as the word itself suggests that ethics should be about promoting consequences. And when the consequences are good, you would have acted appropriately. Now, the problem with that view is if I trip you over, right, and I intend to harm you, but you're blissfully unaware of my intention, and you actually end up in a place where you really like to be, right? Imagine it's a bar filled with chocolate sauce or something like that, right? And you've always wanted to swim in a bar filled with chocolate sauce. You might be really happy, but of course I haven't acted appropriately, right? Because I intended to trip you over rather than for you to land in a nice place. So that's what's emphasized by a deontological theory. The deontological theory would say, oh, hold on a minute, what was your intention? Okay? It's not necessarily the case that you've acted rightly if the consequences are good, because your intention can still be bad. Now, of course, as we sometimes say, the road to hell is paved with good intentions. Okay? So only having good intentions is not good enough either, right? So we probably need a theory that combines a bit of both, because you can still be reckless in spite of your good intentions. Yeah? So a doctor who operates on a patient and who's never actually seen anybody operate on the liver before and decides that they are, quite capable of doing this, but they have no experience whatsoever, might have the intention to make the patient better, but they would be reckless. Because in order for them to be able to operate on the liver, it would actually be quite good if they had some training before they started doing it themselves, wouldn't it? Yeah? So we need a bit of both. We need to think about the consequences of our actions, but we also need to think about the underlying intentions, which is emphasized by a deontological theory or deontology. Okay, if you're still with me, good. If you're not with me, please feel free to raise your hand at any time, okay? Then we've got another theory, which is virtue ethics. And this is not just Alistair McIntyre's work, but Alistair McIntyre wrote a book published in 1981 called After Virtue. And that's had a big impact, that book. Because in that book, McIntyre suggests that if we just focus on consequences and on intentions, we're missing out on what's really important in ethics, which is cultivating character. Remember, when I first defined ethics, I talked about character, right? So from McIntyre, ethics is not so much about trying to promote good actions, but trying to promote the right agent, the agent who commits the actions, right? And that should be the focus. We should make agents become virtuous. And once we have a good idea of what the virtues are, then our actions will naturally follow. Okay, we will know what the right thing to do is because we've cultivated our character. How can we cultivate our character? If we want to study medicine, it might be important that we focus on internal goods. What does that mean? We want to be doctors because we want to make patients better. If we only want to be doctors because we want to make money, right? Because it might be, you might be paid for your work, yeah? Then you could say you're focusing here only on external goods. Money is a good that is external to the good of medicine. The good of medicine is to try to improve the health of your patient. And you might sometimes feel that people talk about our NHS, right? And when they speak about our NHS, it's as if it's our baby, right? Okay? We feel that we're all in this together, and this kind of sense of community where people feel they want to work because they want to be part of that community, okay? And that might drive them on, that sense of collective identity that people get when they are part of our NHS, okay? But there's some tension here because many people also associate with the NHS, as well as with many other healthcare institutions, a culture of individualism, which kind of runs counter to this focus on internal goods, because you might start valuing things that are quite different from the good for the patient, right? You might think about money, you might think about climbing the ladder, okay? And things like blaming the victim, scapegoating, okay, and bullying might follow from this culture of individualism, okay? So rather than think about how we could make things better when somebody has made a mistake, we blame the victim, okay, in an individualistic culture. Or even worse, we might treat them as a scapegoat, right? The scapegoat is somebody who actually hasn't done any wrong, but who is blamed for something that goes wrong within the organization, okay? Often people feel the need to point the finger at somebody, right? Because it feels as if they're doing something, but this actually may not necessarily be a useful thing, even if sometimes it may be necessary to hold people to account for what they have done, okay? And bullying, of course, is another practice that sometimes is associated with some aspects of healthcare as well. And that's also because there's too much of a focus on external goods. Okay, so principlism is another theory, and I think it combines particularly consequentialism and deontology. And this is perhaps a useful framework to have in the back of your mind. Yes, we need to cultivate the virtues. McIntyre is absolutely correct. But when we are thinking about a particular situation, it might be useful to think about these 4 principles. Am I promoting the autonomy of everyone involved by what I'm doing? Okay. So this is not just the autonomy of the patient. You need to get the consent from the patient, and the patient needs to be informed, because if they're not informed, they don't really give their consent to a treatment. But it's also about your own autonomy as a doctor, as a healthcare professional, right? Are you happy to provide this treatment to this patient? Does it not compromise your will, okay? Your ability to determine yourself what you wish to do with your body. That's what autonomy is about. What you wish to do with your body, and also what the patient may wish to do with theirs, or may not wish to do, right? Because they may not consent to an operation, say, for example. Now, if a patient doesn't give their consent to an operation, it may be the case that the patient lacks the capacity to be autonomous. For example, if they have very severe mental health challenges, they may not be autonomous, okay? And in that situation, you might say, look, I don't really know what the patient wants because it's not clear what the patient wants. But I'm still going to try to promote the good for the patient, which is the second principle. Beneficence, doing good, promoting well-being. Sometimes it is not possible to do good without doing harm, okay? Because patients may suffer side effects, okay, from the treatment that you provide. So we do have the third principle, which says non-maleficence. We should try to avoid doing harm. But sometimes it is not possible to avoid doing harm if you want to promote the good. So that shows, again, that there can be a clash between the second and the third principle. And finally, justice is the duty to be fair. So when you're looking after one particular patient, you might spend so much time doing good for this patient that you forget all about the other patients who are waiting in your waiting room, okay? And you might say that's not fair, right? Because of that, some patients may not be able to see any doctor, okay? Because you might run out of time, or you might have so little time with them because you spent so much time with other patients. So that's where the justice issue comes in. What is fair? Yeah. It also comes in when we think about, for example, allocating healthcare resources, both within our own country as well as internationally, right? As you probably know, relatively affluent countries had a lot more vaccines available to them than relatively poor countries during the COVID-19 pandemic, right? So you could say, is that fair? Does that comply with the principle of justice? Okay. Right, and you can apply that to some cases, this framework, okay? So we have a trial here from 2006 by Parexel, which is a clinical trials unit based in London. £2,000 was paid to 6 healthy volunteers. All were given a particular drug. They were all being given this more or less at the same time, and all ended up in hospital. Now, 4 out of the 6 developed multiple organ dysfunction and suffered from a severe inflammatory reaction, a cytokine storm. Okay. In fact, some of these volunteers had some of their fingers amputated as a result of participating in this study. Now, if you think about the 4 principles, yeah, what stands out for you here? Remember what the 4 principles are? Autonomy, beneficence, non-maleficence, justice. Which of these principles might be compromised by this study when you just look at it? Anyone? All of them. Why? Yeah, you're probably right. You're probably right. 2 for me stand out for sure. The first one, autonomy. Why? If you promise me a lot of money, I'll do anything for you. Right? So autonomy is about the ability and the capacity to make an autonomous choice. Are you really still able to make an autonomous choice when somebody gives you a lot of money? Right? Maybe £2,000 is not that much. But if you are suffering from crushing debt and you do not know how you can get yourself out of it, then the prospect of participating in a study that will cost you no more than a couple of hours of your time and receiving £2,000 might be quite nice, right? So the question is, do you still give an autonomous choice in that situation? Yeah, I think it's an important question. And legally, this is not prohibited. People are allowed to be paid to participate in clinical trials. Yeah. The other one that stands out for me is non-maleficence, not doing harm. Of course, this trial caused harm. Does that mean that the trial should never have taken place? Not necessarily. But there is something that the researchers could have done to minimize the harm. If you look at the third bullet point, it's kind of a giveaway. I totally agree with you. Exactly. Yeah. The trial should have been staggered. They should have given the drug to the first one. They should have waited to see what happens. If nothing serious happened to the health of the first volunteer, then maybe it would have been appropriate to give the drug to the second volunteer. Yeah? To minimize the possibility of harm. Okay? Good. Right. We can also question the beneficence, of course. Were they really trying to do good? Well, arguably they were. Of course, there might have been a profit motive underlying the research. That's doing good, but it's not necessarily doing good for the whole of humanity, right? It's doing good for the interests of the people carrying out the study. Right. Okay, so these are the questions that we can ask in relation to the study, I think. So apart from formal ethical theories, we also need to develop material ethical theories. And I think this is really, really interesting. Material is about the concrete things that matter. We also call them axiologies. And whilst my job is by and large teaching medical ethics and biomedical ethics to the biomedical science students, I very regularly talk about ethics in general, because many people think that when we talk about healthcare ethics, only human healthcare ethics should be focused on. But of course, this is not necessarily the case, right? Whose health matters. So this is the object of concrete ethical theories. And if I'm a radical individualist, you might call me a psychopath. It's just me, myself, and I. Nobody else matters. I'm just going to look after my own health, thank you very much. And everybody else, it's not my concern. You might call that radical individualism. I hope that none of you are radical individualists. Or you could be strong anthropocentric, right? Only human beings matter. Non-human beings don't matter. Yes, non-human animals can also be healthy or unhealthy. The same for plants, perhaps. But I don't care. I only care about human health. Okay, you might say, if you adopt this kind of perspective. Then there's a position I call evolutionism, whereby human beings would matter a great deal and more than any other organisms, but other organisms would matter more the more closely they are related to the human species. Now, the question, of course, is how closely related are different organisms to the human species, and why should that matter? Yeah, whether or not something looks more like us. Some people might say that's just arbitrary, right? And then we have radical biocentrism, which is the position that says we should adopt species impartiality between all living species. So it's as problematic to eat a plant as it is to eat an animal. Because we should adopt species impartiality. All living organisms have got the same value. Right? If you think that the value is very high, it might lead you to adopt a very restrictive diet, perhaps a fruitarian diet. Because if you think it's inappropriate to harm a human being, then by the same logic, you would find it inappropriate to harm a plant. Because they all have the same value. Right? Or ecocentrism. Perhaps we should be motivated by promoting the beauty, stability, and integrity of ecosystems, and maybe of the whole planetary ecosystem, right? Whatever we mean by the beauty, stability, and integrity of ecosystems. When is there integrity in the ecosystem? So one North American philosopher with the name Jack Callicott once suggested that the human population should be roughly twice the size of the bear population. Now, I don't know how many bears there are on the planet, but I don't think there's all that many. And there's almost over 8 billion people, I think, on the planet. Okay? So this is why Jack Callicott said, because human beings are like parasites on the planet, we should kill off some human beings to safeguard the beauty, stability, and integrity of the planetary ecosystem. He actually changed his theory subsequently, and he didn't decide to sacrifice himself for the ecosystem. Right? He's still around, actually. Okay? But you can see, if you adopt that kind of perspective, you've come a long way away from strong anthropocentrism. Yeah? Strong anthropocentrism, only human beings matter. Ecocentrism, only the ecosystem matters. So the key questions for an axiology are who matters and who matters more. Okay? So, on the left, we've got a molecule, a water molecule, or at least a representation of a water molecule. And on the right, we've got a euglena. Now, imagine that there's just one euglena, which is a unicellular living organism. Imagine it's just one. So we compare like with like, one with one. Okay? I know you can see two in the picture. So, and I'm asking you, you need to destroy one or the other. Okay? That's a thought experiment. You need to destroy one or the other. Which one do you destroy? Do you destroy the molecule or the one unicellular, single-celled organism? Who destroys the molecule? Can I see a show of hands? Okay, and who destroys the single-celled organism? Okay, the vast majority destroy the molecule. Yeah, you destroy the single-celled organism. Yeah, why? Molecules can't be destroyed, you see. Atoms can't be destroyed. I see the logic. Yes. Okay, you could say, whilst you destroy the molecule, you don't really destroy it, because at least the hydrogen and the oxygen atoms will continue to exist, and presumably they can fuse again to become a water molecule again. Clever. Clever. Yes. But I assume the reason why many of you decided not to destroy the living organism is because you thought, well, actually, there's somebody alive there, right? There's somebody at home, you might say, right? And they can be harmed. So is there somebody at home in the molecule as well, right? Maybe there is, but maybe that somebody who's at home can actually be reconstituted subsequently. Or on the left, we've got a specimen of Homo sapiens, which is our species, and on the right, we've got a chimpanzee. Now imagine that you're on a lifeboat and you can't throw yourself out of the boat, folks. You need to stay in it. And unfortunately, there's only space for one more individual. And you've got two swimming in the sea next to you. And you need to pick out the human being or the chimpanzee. Imagine that neither of them are going to be harmful to you. They're both very kind beings. Who do you save? Who saves the human being? Okay, and who saves the chimpanzee? Okay, the majority of you save the human being. Arguably because some of you might be speciesists. A speciesist is somebody who gives moral priority to members of their own species. That could be one explanation that you might give to save the human being. Okay, and some people question that. They say, oh, hold on a minute, that's not right, right? If the human being would be severely disabled, some ethicists say, right? I'm not saying I agree with them. Then, and then the chimpanzee would not be disabled. The chimpanzee may have interests that are superior than the interests of the human being, and therefore we ought to give priority to the organism that has the most advanced interests. For example, a capacity to plan their life. Right. That would not make you a speciesist, because it would make you an interestist. You focus on the being that has the greater interests. So what should we be? Should we be speciesists? Should we be interestists? That's an interesting question, which also comes up in many other cases we might discuss. So on the left here, we have a human embryo, and on the right, we have a baby, right? And again, you might ask yourself the same question. Imagine that you can use one of these two for research, but unfortunately, by using them for research, you're going to destroy them, okay? And you need to commit to choosing one or the other for research. Who will choose the embryo, the human embryo, for research? And who will choose the human baby? Everybody would go for the human embryo, right? Now, if you're a speciesist egalitarian or an egalitarian in relation to all human beings, which means the idea that all human beings should be treated equally, then maybe that doesn't make sense. Just say, well, look, we should just toss a coin because they both have equal value, right? But if you do not adopt that position, then maybe you come up with something like an interest account. You say, look, the human baby has got some interests that the human embryo does not have. That might be morally significant here. On the left, we've got a nice table, and on the right, we've got a chair. And you need to destroy one or the other. Who will destroy the table? I'll put my own hand up there as well. Okay. Why the table? Yeah, I like sitting in a comfy chair. I totally agree with you. Absolutely. Who would destroy the chair? Totally agree again. Doesn't look quite as nice, but now I'm going to give you a little bit of information, which will probably make you change your mind. So we have to imagine, of course, that the girl is not in the chair, right? Yeah, I want to compare the table with the chair. Yeah, right. The chair belongs to, or used to belong to Roald Dahl. Imagine that both of them are in your possession. You've got the table and you've got the chair. Are you still gonna smash up the chair? You smash up the table, don't you? Why? Yeah, you might make a lot of money, right? If you could sell that chair to the Roald Dahl Museum or wherever it may be, there may well be quite people who are very interested in having that chair. Okay, but when we consider which one to smash up, it's interesting, we don't really think about the value that the table or the chair might have for themselves, do we? We just think about the instrumental value for us, yeah? The value that these things might have for others. And that's a really important discussion in ethics. This distinction between intrinsic value and instrumental value. So when we ask the question of who matters and who matters more, essentially what we're asking is who has got intrinsic value and who does not have intrinsic value, right? Does the table really have intrinsic value? Well, arguably not. It just has value for others. It doesn't have value for itself, right? But if we think about a living organism, such as a unicellular organism, things might be very different. You might say, hold on a minute. That euglena seems to swim towards, if you put this euglena, and then, well, I'm not sure euglena, if you put an amoeba, which is a similar kind of organism, in a solution that contains both alcohol and water, the amoeba will swim towards where the concentration of water is the highest and away from the alcohol. Okay, some students, if you put them in a solution of water, they will swim towards where the concentration of alcohol is the highest, just the other way around. Okay, that's a joke, an attempt to make a joke, right? Okay, so you see, so even if the euglena is not capable of valuing its own life, it might at least be able to appreciate the things that contribute to its life, such as the presence of water, yeah, rather than alcohol. Okay, so perhaps the euglena, therefore, as well as the amoeba, I'm not sure about whether the euglena would also swim away from the alcohol, I'm not sure, might therefore have intrinsic value. The table in the chair probably doesn't have that kind of value. Maybe the molecules inside the table in the chair might have some intrinsic value. They might be able to appreciate some things that make them exist. We don't know. We don't know. But certainly, even if they do, if you smash up the table or the chair, the molecules will continue to exist. And they can carry on appreciating their existence if they are capable of doing that. Right? Okay, so can something that's incapable of appreciating, valuing anything have intrinsic value? So this is a question you might ask in relation to, for example, the human embryo, where there's a lot of debate. Do they have intrinsic value? Or are they capable of valuing life? If they are not capable of valuing life, what will be wrong with destroying them? Okay? Well, you deprive them of a future where they might then value life. That might perhaps be problematic. But at the moment, if they're still not capable of appreciating life, then maybe the destruction would not be so problematic, some people claim. Okay, how does the value of something compare with the value of something else? Moving on. So in medical ethics, it's also important to think about professionalism and the law. So far, we've been thinking about ethical theories. But in order to have good ethical theories, it's also good for us to look at professional guidance. Okay? Professional guidance might come from something like the General Medical Council, because it regulates the medical profession in the UK. And law is also relevant because we must make sure that we abide by the law, by and large, right? Because the law might be based on sound moral guidance. Not necessarily, but nevertheless, we should not simply ignore the law. The tools of the ethics trade: logic, analogies, and thought experiments. Okay, and when I talked about the lifeboat scenario, for example, I talked about a thought experiment, which is a kind of analogy between a real case, whereby we're not quite sure how to resolve a puzzle, and an imaginary case, whereby, for example, we imagine the human being and the chimpanzee being in the sea, and there only being space for one in the lifeboat. Okay, that might help us to think about the real value in the real world of a human being as compared to a chimpanzee. Okay, logic is just about consistency. We need to try to be consistent. Okay, I hope you'll agree with that. We don't want to be called a hypocrite. Okay, but if we're a psychopath, then maybe we perhaps should be hypocrites. Because if we follow our values, if we're psychopaths, then things could go very horribly wrong. Which is probably one reason why we have the law. Because we want to make the psychopath act inconsistently with their values. We want them to adopt the values of others. And we threaten them with some sanctions if they do not follow the law. Okay? That's why consistency is a value for most if they have the right values. But if you don't have the right values, maybe you shouldn't be consistent with your values. Does that make sense? Yeah? Right. Typical topics in medical ethics. I've listed some of these here. They'll not be surprising to you. This is a book published by Tony Hope 20 years ago, exactly. Euthanasia, resource allocation, reproductive medicine, mental health issues, genetics, medical research, and treating children are the 9 topics that he deals with in this book. This is a book that I published almost exactly a year ago, and you find the same topics, right? Now, I'm not saying that this is all there is in medical ethics. There are many more topics that we could talk about, but this is just a sample of what I think is probably useful for us to think about when we think about medical ethics. The reason why I've emboldened some words is because I've added some new topics that aren't dealt with in the book by Tony Hope, right? And the reason for that is that the duty of candor has become a legal duty that should be adopted by all healthcare professionals in the country now, and therefore it's important to talk about that. I also think it's important to talk about the use of non-human animals, because a lot of medical science is underpinned by using animals in experimentation. So therefore, we really should be thinking about whether this is appropriate, particularly because this has elicited a lot of public controversy. There's also a lot of debate about topics 8 and 9, right? Genetic engineering and embryonic stem cell research and cloning. And there's more debate on these topics now than there was 20 years ago. The reason for that is that the science of genetics has moved on dramatically, okay? As well as embryonic stem cell research and human cloning, which was first practiced in a mammal, Dolly the sheep, some of you may have heard of, right? Was born in 1997, I think, in Edinburgh, okay? So this has become more topical, these sorts of topics. Right. These are some topics that have been neglected and that I think we really need to think about. Ethics of aging, because we live in an aging population. The world population is aging very rapidly, and this raises specific issues as to how we're going to be treating such large numbers of people when they are no longer productive and when they might require very complex medical treatment due to the fact that they might have many different diseases at the same time. Ethics in relation to artificial intelligence. The reason for that is that in the good old days, the doctor would keep your data in their desk, right? Now they have computers, and with the advances in informatics, the data can be shared very widely across many different networks and so forth. So this requires a lot of thinking as to how you deal with issues related to people giving their consent for the sharing of their data, okay, across healthcare, across the whole healthcare service. And ecological ethics. And this is also an important issue precisely in relation to artificial intelligence and ethics, because the development of computer systems has actually required a very significant amount of power, i.e. energy, okay? And a lot of this energy is produced by burning fossil fuels, okay? And the burning of fossil fuels, as you no doubt will know, causes climate change, okay? So that's why ecological ethics also needs to be increasingly addressed. So to summarize, we have defined ethics and medical ethics. We've talked a little bit about values, principles, and theories. We've talked about the difference between formal ethical theories and material ethical theories, given some examples of each of those. And we've talked a little bit about the tools that can be used to develop ethical reasoning, including logic, the making of analogies and thought experiments, whereby we try to focus on how similar situations should be dealt with in particular ways. And the common tools of the trade include the use of, logic, analogies, and thought experiments, yes, as I've just mentioned. Okay. Thank you so much for attending, and please feel free to ask any questions that you have.